Hi, so I am doing my self-reflection, the individual reflection on the COPD simulation. So, I would say prior going into this simulation, I felt pretty confident. Um, I felt like we've learned a lot in didactic about COPD, and um, I've actually been able to see patients with COPD in the clinical setting. Not really much as much of a COPD exacerbation. It more often was patients that came in due to another condition, and part of another chronic illness they have is COPD. So I haven't really gotten to see an exacerbation, but I did feel pretty prepared going in, and reviewing his chart prior to when we did the initial MPW. I did think a major problem with this patient was definitely going to be his exacerbations, and also the fact that he's lost his wife. There's a question of alcohol abuse, the smoking, lives alone, anorexia. Like, I just thought there was a lot of like psychological, psychosocial problems going on that we are going to address throughout the scenario. So that was kind of where I was at when we went into the whole simulation. So, any ethical dilemmas that occurred during the scenario and how you might respond differently based on the simulation. So, again, there wasn't like a huge like ethical dilemma in this situation. We did make some wrong choices though that I think are kind of a big problem. So, one thing I really didn't know at first, I thought it was an ethical dilemma that she gave the ceftriaxone when he had an the allergy to um ampicillin and like ceftriaxone. Sometimes you can have an allergy to that when you're allergic to like penicillin, so it all was kind of correlated. But I'm thinking, since his reaction to ampicillin was so minor, and like there wasn't any confirmed that he had an allergy to ceftriaxone, they were going to try it. And then if he did have an allergic reaction, since his other reaction is just like an itch, like that's all that would happen. So I guess they just wanted to try it since it was like the first line drug for what was going on. And then if he did have the allergic reaction, that they would take him off it. And that is what happened. So I'm assuming that isn't like a really ethical problem. I was a little confused on that at first, but I guess kind of like looked into it more and realized that it was okay, since he didn't have any like confirmed reaction to that specific drug, and his other reaction was so minimal. Um, I'm not sure again if this is an ethical dilemma. When she was preparing to administer the ceftriaxone to the patient, she was asking about his allergies, and he said that he had an allergy to a drug, but that he couldn't remember the name of it. Um, I just She never dug any further. She was just like, okay, so I don't know. I thought that was kind of like a problem. I think it's kind of important to make sure like your chart is matching up to the patient knowledge, or at least like confirming somehow. Um, so I don't know. I That made me feel like a little confused in that situation, because I just think there's so much emphasis on verifying all of that. Like, maybe at least asking him, like, does she remember? Does he remember like what the drug was for? Like, I don't know, anything kind of to dig a little bit deeper to figure out what drug it is, to make sure he can confirm. But I do know he isn't very like alert and oriented, which maybe it would be important to like call his daughter or someone to come in, or like his medical like decision making, like whoever has that power, if it's him or if it's someone else, like have them come in to like help with these type of situations, especially since he isn't as like alert to the situation that's going on. Sorry, my dogs are playing in the background now. Um, this isn't really an ethical dilemma. It's just something I didn't think made much sense. Every time she was going to count his respiratory rate, she told him, and I feel like we've always learned that that's kind of something you do. Like you can be like checking their pulse, and then you like act like you're still checking their pulse, and you listen to their respiration rate. Because when you tell someone that you're watching their respiration rate, they can get kind of like nervous, and then they like focus on their breathing and then think about their breathing. So that wasn't like an ethical dilemma. It was just something that like kind of bothered me because I was like, why do you keep telling him you're listening to his respirations? Because now he's going to be focusing on his breathing and trying to like make sure his breathing is normal, taking like deep breaths, all of that. So that was something I didn't like. Another like problem was that I mean, it wasn't really a problem. She didn't catch his worsening condition. Another nurse that came in, the respiratory therapist, had to notice it. I mean, that could just be because it happened very suddenly, and she just hadn't been in there yet. But I know that can sometimes be a problem because, like, what if that person didn't go in there? Like, it is the nurse's responsibility to be continuously monitoring. But like I said, that could have happened in such a short span of time. We don't really know. The big ethical dilemma that we had as a group was that we didn't notice the chest tube. And looking back, it makes me so frustrated because it was like right there and we just didn't see that part of the video. Like it missed. I'm guessing we were like writing down notes or something and just missed it. Um, but it did cause us to make the wrong choice. Um, and it put our patient in danger. So this was a big problem. It's so important to just be focused on everything that's going on with the patient. I know it's hard and sometimes in these simulations because they do skip over like when he went to get it and like the consent and all of that. So suddenly it's just there. Um, so that was something we definitely had a big slip up on. I'm not sure if that's considered an ethical dilemma, but it made me mad at myself. Um, and that kind of ties into the describe an aha moment you experienced during this learning experience and how it will expand your nursing care. Again, like I probably am going to talk a lot about the chest tube during this because that was like so frustrating to me looking back, like how I missed that and how it affected our simulation. That was my aha moment was the chest tube because I'm reading this question and I'm like, oh, this has to be the right answer because all the other ones about chest tube and he doesn't have a chest tube. And I picked that answer and it was wrong. So then I go back and I look and there's a chest tube and it's like, oh my goodness, like how did I even miss that? That was my big aha moment. Um, I was so mad at myself. I think as a group we were like, what? How did we all three of us miss that? But I don't know. That was my big aha moment. We definitely put our patient at risk, didn't give him the best treatment that he deserved and could receive due to missing that. And I know, like, probably in the clinical setting, we wouldn't miss that because it is kind of like a different situation, but it does show you how important it is to focus on your, like, client's care from, like, point A to point Z, the whole time. And just making sure that you're assessing everything. And if you could have missed something or it doesn't make sense, just like double check, triple check, like ask other people, look at the chart, really do everything you can. So that definitely, like in my care, I'm always going, as I said in my other video too, my reflection, these simulations are really drilling in my head the fact of like double checking, triple checking, using your resources, making sure you're really paying attention and focusing and not making decisions when you're not sure of yourself because it's a person's life in your hands. So it's not okay to just guess or choose what seems the most right with this stuff. So the next question is, what are some aspects of client care that you didn't feel prepared to make clinical decisions for in the scenario or after completing? So I kind of have quite a few that I just like jotted down to talk on. So it was kind of like the daughter. I know, like especially in real life, like it was a little bit overwhelming in this scenario, but I know in real life it could be even more. She was just it was helpful because she was a really good advocate for him and like a source of information. But it could get overwhelming, I know, especially in real life when she's talking about like his living alone and the mother passing and his smoking and his drinking and his exacerbations and the fact that she's worried. I know it can get overwhelming to try to like help and educate and calm in this situation. Um, but it was kind of helpful. Like we realized, like as the nurse, we have to just allow them to express their emotions, both of them, and then educate them on like the resources that we can provide to them and the steps they can take going forward to help prevent any situation like this from happening again, where he's like unconscious on the floor in an exacerbation because he lives alone and he's going through this like probably depression due to his wife's passing that's leading him to use alcohol abuse, to smoke with the COPD, the anorexia, like he's lost his desire to eat. So we can really help them like express their emotions and then offer them the different resources that we can provide them, such as like psychosocial therapy, like home health care, maybe even like a facility, all different things to help ensure his safety and to prevent something like this from happening again. Um, so something I definitely wasn't prepared for was when all of a sudden, when a therapist came in and gave the albuterol treatment, they came out to the nurse's station. They were like, yeah, his breathing's diminished, like he has pleuritic pain, increased shortness of breath, like he might need more treatments and an x-ray. Um, I was like, okay, it was kind of caught me off guard because it seemed like he wasn't really in like a lot of like shortness of breath and everything, like his breathing was getting better, but as I said before in my other video as well, like um it's so fragile, like the patient's state. You can never be so confident in how they're doing. You always have to be ready for something to take a turn and always be really assessing everything thoroughly to make sure that it's still going well. So it did catch us off guard, and I was kind of like confused by it at first, like where is this coming from? Like I felt like we were just in there and he was doing good, but it really like helped me realize like, yeah, you can never be so sure of that, and like he has this chronic condition with like other factors he's doing that's not helping the prognosis. So we really have to be constantly monitoring him. And I guess like it kind of slipped up on that because maybe it was important for like recommending the new x-ray earlier on or something like that. But yeah, it all came very suddenly, and I know like especially like in person in the clinical setting, like that would be a very like overwhelming situation because it even was overwhelming just on the virtual simulation. So yeah. Another thing I wasn't really prepared for is just like we always think when you're having those breathing problems, like turn, cough, deep breathe, ambulate, oxygen, like your albuterol treatments. But it's important to remember that these aren't always effective, especially someone in like this COPD exacerbation. Like sometimes it's not enough, and you have to be continuously assessing them, getting those x-rays done to make sure that it is getting better with the treatments you're providing, because she was providing those treatments thinking like, okay, this is probably helping him, like his oxygen looks good. But then now he has this pleural effusion and all of this going on. So like those are like the therapeutic techniques we can use, but they're not always going to be like effective. So we have to be prepared for those not always to be like, those don't always work, and those should be our first line because we always want to like try those first and see if we can relieve any pain or discomfort with that, and if that's going to help his exacerbation. But in this case it didn't, and I just wasn't really prepared for how things turned so quickly. But it's what makes it more realistic in the long run, because in the clinical setting and in hospitals, like that's how things work. Like 1 second your patient can be fine, the next second they can be coding. So it's definitely very like, it was a good opportunity to work with this, and it was definitely beneficial like in the educational standpoint of it, um, to kind of see how quickly things can change. So yeah, the doctor comes and then all of a sudden he needs a thoracentesis, he has a significant pleuritic effusion, and we're considering a chest tube. And again, it was something I was like, oh my goodness, like I felt like he was just doing fine, now he needs like a chest tube and all of this. And then that goes into the whole chest tube thing. I definitely 100% was not prepared for like the questions with chest tubes and like how we handle chest tubes. This definitely was a big learning experience for me, which I am grateful for. It's so important to be like, when they have that pain there, assessing the connections, like assessing the drainage box, like looking at all of that, not just like, well, we chose like listening to the breath sounds in that area. Like, no, of course, like we're thinking of those ABCs, but if he's having pain at that chest tube, like we need to be assessing, even every time we go in, we're looking at that drainage box and everything. So, that was something I had struggled with and I was not prepared for at all. I probably should have, reviewed more going into it. But it definitely pushed me to review more after, and it's definitely gonna help me in future experiences because um, now I know more and I know so much more about these situations and our priorities and how we're gonna handle that. So that was definitely a big learning experience for me. Um, and also, I wasn't prepared for him to code. Of course, I know it's a possibility going into SAM, but we go in there and all of a sudden it's a code blue, and it resulted in him being on a ventilator. And it's just like our decision making and us like not really being prepared enough going in that led him to be on a ventilator instead, because we did like go through it another time just to see like what else would have happened with the correct answers. We saw that he would get sent home on like an inhaler treatment and all of that. So it just shows you like if you don't go in prepared and like use your resources, have knowledge in what you're doing, like how detrimental you can affect the outcome for your patient. So yeah, generally just not prepared for the turn it took, the chest tube, the coding, like all of that just kind of took me by surprise, and I definitely think I should have had more knowledge going into it, and that would have helped me a lot. But I'm glad like these type of simulations can really help me like focus on what I need to know more about for my clinicals. Okay, let me look at what the last question is. So the last question says, describe 3 to 5 important concepts you learned from this scenario. Then describe how you will apply your knowledge of each concept to future clinical situations. Okay, so I have some that I jotted down I want to talk about. So my first thing, I kind of realized it was actually something like really small. When they were talking about what's important at the care plan at this time, and like dietary preference and the activity tolerance wasn't relevant. I just I was thinking of like long-term care, and it's important to like realize like sometimes your care plans are like short-term, like where we want to resolve these exacerbations. So his diet preference, like he was NPO, it wasn't relevant at this time, and his activity tolerance, like not relevant at this time, because right now all that we were focusing on was getting him out of that exacerbation state. So I think that was helpful for me to learn that like your care plans, sometimes you have like your short term, you have your long term. It's important to realize like what you're focusing on and what you don't need to include in these, because otherwise you're gonna be overwhelming yourself with so much information, so much planning. So that definitely helps me realize like in the clinical setting when I have like what's more important at this time. Am I doing a short term plan or am I planning long term with their discharge and their care throughout the whole stay? Um, I think that that's really important. And that helped me realize the different type of planning and different care plans and prioritizing. Sorry, I think my headphones are about to die. So I'm gonna disconnect.